And first order of business is public comment. Michelle, do we have anybody from the public who wants to address the committee?
No, I haven't received anything, Rich.
Okay. And again, I know I sound like a broken record, but this is a consequence of COVID that it seems much harder to get public engagement, which is really unfortunate. But I guess we just have to keep asking, and hopefully we get to the end of this pandemic and we can have people coming in to visit with us. At any rate, any changes to the agenda? I would like to propose moving our guests to the next item of business so that we can hear from them, but any other changes anybody have? Actually, I would like to take care of the minutes approval from October 15th, 2020. Can I get a motion on the minutes? Glenn moves, Anna seconds. Any questions or comments on the minutes? All right, ready to vote? I'll call in order. I see people on the screen. Glenn?
Yes.
Mike?
Yes.
Anna?
Yes.
And Henry?
Yes.
All right, great. And I will save appointments and chairs report until after. I had invited Jessica Jansen and Brad Walworth from CARS, Cuba Addiction Recovery Services, to come in. I had attended the ribbon cutting, I'm not sure what it was, in the lobby of CARS for the launch of the methadone program. And we've been having some discussion about what's been going on with addiction issues in the county, and particularly overdoses. And I thought it was a very timely thing to see if we could get an update. So thanks for coming in. And Jessica, I'll turn it over to you.
Good afternoon, everybody. Thank you for having me. I really appreciate having the opportunity to talk with you guys about what's going on with addiction. Because questions were specific about the opioid treatment program, I'll start there. So we successfully opened that program in January. And to date, we have roughly 80 people, just over 80 people participating in that program. We did have to apply for an extension. So originally we were slated to serve 50 people, and we were approved to go up to 100. We're nearing that and are probably going to have to ask to go beyond that at this point as well. Throughout the pandemic at the opioid treatment program, we have had to stay open because it is an essential service, and particularly for new clients, it's not always possible for them to have take-home doses. So for our patients who it was appropriate for them to take methadone home on a weekly basis, we accommodated that, but the majority of our clients come on a daily basis, or at least every other day, to our site at 334 West State Street to get their methadone. I'll pause there and ask if you guys have any questions about that program in particular.
Well, if you could comment, prior to you launching, it's my understanding people had to go out of town, and so that on a daily basis they were going to the closest methadone program. Is that correct? And how was that working?
That is correct. People had to go to Syracuse or Binghamton or even Rochester at times to get their methadone. So when we opened, we made sure that we communicated throughout the community to let them know that we now had this resource. We did not have as many transfer patients as we expected, or I guess as the previous administration expected. I had came on in January. So we didn't have quite as many transfers as we thought that we would have. There were a handful. The majority of our clients are actually new to the program.
And why do you think that's gone? Why do you think that's happened?
Why do I think that we didn't have as many transfers as we thought?
I guess both, yeah. Yeah, that's interesting.
I can't speak to how the numbers were gathered prior to my start. So I would guess that we maybe overestimated the number of people that were traveling out of town. Another thing I've heard from clients, and Brad, jump in here if you have additional information, but when some clients are established with their counselor and their OTP program, they develop a certain comfort level with the doctor who's prescribing, with the counselor that they're seeing at the existing program. And that is a hard transition for people who are struggling with substance use disorder. So there's a number of clients who don't want to transfer necessarily. And if they have transportation or are able to get to the other clinics, that is their preferred clinic. I don't know if, Brad, you want to add to that?
Yeah, actually, I do a lot of outreach to the other counties, for example, Broome County, Onondaga County. And in talking to the other programs, I've got to believe that some of the expectations for the number of people that were actually going out of county were initially early on in the stage might have been a little overinflated, because I've heard from a lot of program directors that they actually did not have as many people from Tompkins County using their programs as we thought they had.
Okay. Right. And my recollection is that the county through the DSS helps pay for transportation costs for some of these people. Is that correct?
So Medicaid, so if they use Medicaid transportation, I'm not sure what DSS does specifically for clients going out of county, but anyone who uses Medicaid transportation, that's obviously a cost that falls back to the taxpayers.
So certainly if people had been transported before, this is saving a lot of transportation costs to be able to have them treated locally. Absolutely. And it does seem like there's high utilization of your program. And I guess that was the second question I had is, why do you think that is? I mean, why are there new people, I guess, is I'm asking. This is interesting.
So I think that the resources that were available before was Suboxone, right? So opioid use disorders often treated with Suboxone. And I think that for patients who knew that that was available, that was the avenue they chose, was to stay on Suboxone. Methadone works better. So now that it's available, clients tend to prefer methadone over Suboxone in some cases. And I would say that a bulk of our patients have transferred from a Suboxone use to methadone use.
Okay.
I believe that's because it has less side effects, if I'm.
Yeah. Okay. And Anna, I see you have a question.
Yeah, thanks, Rich. You asked a few of my questions, but it sounds like, and thank you so much for coming and for this information and for all the work you do. This is so important. It sounds like the numbers have increased over this program. So I'm just trying to wrap my head around what you are seeing as like reasons why. Is it that we are seeing greater drug use and therefore greater people who are wanting to transition into treatment of that and management of that? Are we not seeing significant increases in drug use, but we are seeing significant increase in the number of people who are seeking treatment? I'm trying to get a grasp of, I guess the larger picture for me is, what has the impact of COVID been on drug use and drug treatment? And so that was my first question.
So I think that the impact of the pandemic on substance use disorder in general has, this is a population who is already isolated. So the added isolation increases more of the mental health needs. We have not seen a significant spike in, sorry, I just saw the comment below. We have not seen a significant spike from our outpatient program. That number of clients attending has actually remained steady from January right through until October was the last numbers that I looked at. So from that perspective, I don't think that we have seen a spike. I think what we really are seeing is a lot of clients transitioning from Suboxone who were already receiving treatment onto methadone. So from just a simple numbers perspective, I don't think that we're seeing an increase necessarily in substance use among a greater number of people. I think that they're seeking treatment differently.
So it's not neither is it an increase in number of people seeking treatment, is what you're saying, just substituting types of treatment.
Correct. Now, that said, the clients who are coming into our methadone clinic are not coming from our outpatient program. So they're coming from other places in the community. So they may have been getting Suboxone from other providers. And because those other providers do not do methadone, they have transferred to us. So there's not crossover. The 80 patients that are being seen in our opioid treatment program are not coming from the numbers from our outpatient program. So those are new clients. I just want to make sure I clarify that.
They're new clients, but not necessarily new clients to treatment. And that's
Correct.
the clarification that I wanted to make, or that I'm hearing that's important. And the other thing is, of these 80 people are a significant number of them seeking other types of collaborative or coordinated treatment. I'm curious what other support systems many of them are seeking.
So when you say that, do you mean in addition to what we provide at CARS or other treatment at CARS?
Well, I mean, from a public health perspective, just doing this treatment isn't necessarily a full package of what can support. Often there's mental health support or housing needs, or there's a whole suite of things. And I'm wondering how much inroads we've made through the program in encouraging people to do other supports, and whether they're taking advantage of it and how that is happening.
So all of the clients who are in the opioid treatment program are seeking individual counseling with an addictions counselor through CARS. We also refer to the county mental health program when we identify that there is a mental health need. We also work with the client on things like applications for housing. So we do that through our addiction counseling services. We also offer group therapy, and we do that, through the pandemic. That was particularly challenging, but we have created what we call our hybrid groups, where there's a couple of people in a room, masked and adequately socially distanced, and then a couple people on Zoom, and facilitating groups that way, so that there's still that level of engagement with other people as well who are also struggling with substance use disorder. That's really important for our clients because they're already isolated. So those are the other services that they're accessing within CARS and that we refer out to. I don't know, Brad, do you want to add to that at all?
Yeah, actually, also thinking of it, we're also getting people into our residential program now coming from out of the area who have been using methadone services elsewhere, that are able to come into our residential program that we're able to maintain through our opioid treatment program. So these are people that are also receiving, of course, vocational services, mental health services, recreational services, and all of those through our residential services itself. So it's kind of a unique ability there. In fact, on outreach in the past, I had a lot of places asking me if we could take methadone clients into our residential program because they were struggling to find places for them if they needed a higher level of care than opioid treatment programs could provide, needing residential services. But a lot of the residential programs around the state just will not take them in to their programs.
Interesting. Thank you so much.
Hey, Henry.
Yes. Thank you for coming in. I know I was also at the opening ceremony when you had it, but at that point you said you had 50. You were going up to you were trying to get 100. Why do you feel there's enough of a demand to go to 150?
I do. So we, interestingly, we dipped throughout the pandemic for a period of time where we were not receiving a lot of referrals. And more recently, we have had weeks where we've had 5 or even 6 patients come in as new patients in the first week. So I actually was just looking at, I think that Martha's comment below in the chat box, that I think one of the things that I didn't speak to was people who were local and treatment or methadone treatment wasn't convenient, so they continued to use. I think that's a very real reason why we're seeing this growth. But I do think that we are seeing an uptick. I actually think we're starting to get patients from Cayuga County. So Cayuga County is sending people to Syracuse or Rochester right now, but some of those patients are in Lansing or Genoa area, and it's easier for them to come to CARS than it is for them to go to Syracuse. So Cayuga County reached out to me recently asking how we could coordinate better for the patients that can come from Cayuga County to CARS. So I think we're going to start to see clients from out of county as well. And Brad, I don't know if you've heard anything about like Cortland or other surrounding counties.
Yeah, just a lot of positive response from them. The biggest challenge, of course, for all counties seems to be transportation,
Mhm.
but just the amount of positive response is pretty impressive. And Cortland County, Chemung County providers, not just addiction treatment providers, but also primary care, is just very positive about the program we have here, and always willing to recommend us to their clients, their patients.
One other question: is there a limit, or do you just have to keep going up in 50s amount?
Every time we apply, we can only ask for an additional 50 beds, or 50 slots, I should say. So each time we hit a certain threshold, then we would apply for an additional 50. I believe the reason they do it that way is because when you get to 300, you have to make changes to your staffing.
Okay.
So I believe that's why they do it in increments of 50.
Okay, thank you.
I'm curious about the you're prescribing and people come in. I have heard anecdotally about Suboxone that there's a secondary market, that people who are addicted will sometimes sell their Suboxone, but that's not possible with methadone, right? Because the regulations say you have to come in. You said you had 4 people that you can prescribe it on a weekly basis. Is there how is that done?
There was a couple patients that I don't know the number off the top of my head, Richard, but I certainly can get that to you. But there was a small handful that transferred in from other programs who had been on methadone for years. We had one patient transfer, and I think he had been on methadone for about 18 years. But generally, it comes in the form of liquid. So that's much more challenging to sell on the street. But it also, when they're dosing, the majority of our patients are dosing at our program. So they're not taking any medication with them. Okay. So that's why I think it's easier to sell Suboxone versus methadone, because they can't take it with them. Yeah. I am having work done on my roof. So if you guys hear background noise, I apologize in advance. It sounds like they're headed towards my end right now.
Okay. Well, if somebody drops through, we'll let you know if somebody falls behind you. Do you know if that's actually an issue in our community? Do you hear about people trading Suboxone, or is that just urban legend? I see Matt Van Houten nodding his head.
I do believe that is a very real issue in our community, that people do take and sell their Suboxone. Yes.
Okay. All right. Any other questions on this issue? I had asked Jessica and Brad if they could just talk more generally about how CARS has been operating during the pandemic, but I'd like to see if anybody else had questions or comments about the methadone program. Okay. All right. So more generally, how's it going over there?
It's going as good as it can. What I can say is that we are really fortunate to have a team of people who've taken the pandemic very seriously, but also are very committed to serving people with substance use disorder. So when a lot of places were forced to no longer see people in person with our methadone clinic and having to remain open, we had to take additional steps to keep the clients and the staff safe. And that did still allow a location for clients to go in person if they needed to. So though we did the majority of our services via telehealth during most of the pandemic, and we're still continuing to do the majority via telehealth, we have been able to see some clients in person. So when there has been an emergent situation or someone has needed to walk in off the street because they really needed support, we were still there. So that's been really, I think, fortunate for our community that we did still have that option. At our residential program, we have complied with what OASIS has asked in regards to keeping a location open for isolation, as well as a separate location open for those who have to quarantine. And so we've reduced our total census. We did have a couple of weeks ago, our first staff test positive, about 6 weeks ago now. So we had a staff person test positive who had been at the facility. We then tested all of the clients and staff who had been exposed to her And that was actually, we tested all of the clients at that point. Everyone was negative. We had a second staff person test positive. Again, we went through a regime of testing and everyone was negative. And we did have one client who was positive. None of them were related. And there was also no more positive tests after that last client. So I tell you that to say that it sounds as though the staff are doing a really great job containing COVID when it has hit the facility and not spreading. And for those of you who have seen our facility, each of the bedrooms has 4 beds. So it's 4 clients per room, and it's really not conducive to social distancing. So we have been diligent about making sure that we're sanitizing and mask wearing and incentivizing the clients to make sure they're wearing their masks properly. And I think that the recent issues with COVID that we have had are a testament to how hard the staff are working to make sure that that's happening, and that we can continue to offer that service.
Did you have to reduce the number of beds to react to COVID?
We reduced by 8 beds. Yep. So it's a 60-bed facility. We reduced by 8 beds, which left us 2 rooms open, one for isolation for clients who are positive or symptomatic, and then one for quarantine for those who have potential exposure.
Okay. And there was a project to add 25 women's beds. Where does that stand? Is that open, or is it?
We have not even broken ground yet.
Okay.
So we, the documents that are going to be going out for bid for the contractors to bid on the actual building project, they were tentatively supposed to be completed in November. I actually just got an email from the engineer today that we're that much closer, but the documents themselves are still not ready. So right now we're waiting on the architect and the engineer to wrap up their process so that we can get the bid documents out. The tentative open date, and I say that very loosely, is March of 2022 at this time. Okay. For those of you who are not aware, we were a male-female facility. We did transition to an all-male facility in August, after recognizing that about 70% of our unsuccessful discharges were related to inappropriate relationships between clients. And the research shows that, particularly with substance use, single gender facilities are far more successful. So we did work with OASIS around transitioning to an all male facility, knowing that we have the female facility down the road.
Okay. Are they going to be connected, or are they separate?
They will be completely separate programs.
Okay. Right. Okay. Anybody have any questions? I don't mean to monopolize here. In terms of financial operation, has the epidemic caused you any more turmoil than we might expect? Are you able to continue operations?
So yes, we are able to continue operations. It has been an extremely difficult year financially. The pandemic, coupled with other things, such as when we first opened the opioid treatment program, there was not adequate funds to pay the staff to open the program. So we started with a pretty significant deficit. We were able to secure the payroll protection program. That saved us this year. And that has been really helpful. We did take another pretty significant hit when we had the staff and client test positive a few weeks ago. We have to close admissions when that happens to anyone who's not in an emergent situation. So essentially, for our level of care, that means that we can only take people who are homeless when we're going through somebody testing positive. So we were not able to take admissions for almost 6 weeks. So that has subsequently hurt us financially, but we are open again and we are taking clients in, and hopefully we will recover within a couple of months from that.
Okay. All right. Well, thank you so much for coming in and talking with us. This is really informative, and it's great you're doing this work. Thank you. And both you and Brad.
Thank you for having us. I really appreciate it.
Yeah. And I should ask, is there anything that you're looking for from the county? How are we providing the support you need?
Well, I would say money, but that's what everybody wants, right? Honestly, I have worked pretty closely with Frank Krupa since I started, and he has been very helpful. As somebody new coming into the community, as well as coming into this organization and the field, when I have had questions or needs, I have been able to reach out to Frank, and he has been very helpful. So I hold Tompkins County in very high regard right now. I've had a very positive experience, and I came from Onondaga County, not to speak badly of the other counties, but they're very siloed and they don't work collaboratively together. So it's been very refreshing to come into a community where my experience has been that there's a lot of collaboration, and I get a lot of support from other leaders of other organizations.
Okay. Well, that's really good to hear. Thank you. And you're welcome to stay for more of the meeting, but please don't feel you need to. But again, our thanks for coming in and talking with us.
Thank you. I'm actually that call was my daughter's school, so I'm gonna actually run and find out what's going on.
Okay.
But thank you so much for having me. And if at any time you guys have more questions, I'm happy to come back.
All right. Well, certainly it would be great to get a report down the line, maybe another 6 months, a year, and hear how everything's going. So
yeah,
good work. All right.
Thank you. Take care, everybody.
Okay. Bye. Okay, picking up the agenda, we have appointments. And let's see, we have Aubrey Hetznecker to the Advisory Board on Indigent Representation, Suzanne Rien to the Advisory Board on Indigent Representation, and Joseph Kirby as well to the Advisory Board on Indigent Representation, Bridget Nugent to the CJATI, Stacy Congelosi Mike to Stop DWI, Jennifer Olin to EROC, Julie Conley Holcomb to EROC, and Eric Dauber to EROC. Could I get a motion on those appointments? Glenn moves.
I'll second.
Thank you, Anna. Any questions or comments on the appointments? I will call the vote. Glenn?
Yes.
Anna?
Yes.
Henry?
Yeah. Yes.
And Mike?
Yes.
Okay, and the chair votes yes. So that's unanimous. Great. Okay, and then next item is chair's report. I had wanted to hear from CARS, and so that was principally what I wanted to add to our agenda. I do have a comment on some national numbers I was reading on suicides, and particularly in light of the COVID epidemic, there was a prediction that suicides would spike. And what I found interesting is that they actually haven't on a national level. And I haven't heard certainly anything locally that we've had a real rise in suicides. With the talk about, anxiety and tension and isolation, it seemed like this would be a significant issue, and perhaps it will become one, but I thought it was quite interesting that we haven't seen that from a public safety standpoint. So I just make that comment. And moving on, county administration. And I had asked if we could get an update on where the police reform project is and where it's going. And I think Deanna and Jason are here and ready to go. So I'll turn the floor over.
Thank you, Rich. Thank you very much. So where we are with reimagining public safety, picking up on where Jesse just mentioned in terms of the collaborative approach, we're moving full steam ahead in collaboration with the city on an effort. It's been named Reimagining Public Safety. And we've had a series, so let me start from the beginning. There's been a series of subcommittees that have been created, an IT data analysis team, an academic research team, a communications team, and a law enforcement public safety team. And the primary focus of these work groups are to gather information and examine some critical areas as it relates to reimagining public safety. And a lot of the information that's gathered through public session and public feedback and forums is also channeled through these five work groups. These groups have been meeting regularly. I should say, actually, before I go on, is when Deanna came on board in person here, we actually had Deanna take on the project manager role. So she is quarterbacking a lot with working with both all the working groups as well as CP, which is the Center for Policing and Equity, which is a group that's helping facilitate the conversation both with the working groups and with the community. So Deanna has been attending a lot of meetings and keeping each working group on task, ensuring that they're following through with the work that they're supposed to be doing and working collaboratively with all the players, as well as Dominic. Dominic Recchio, our communications director, has been a big player in ensuring the community engagement sessions are running smoothly. As you know, the sheriff, myself, the mayor, Chief Nair from the city also did presentations before some of the community forums and community voice forums took place. And Dom has been a key player in making sure that the public interface piece is working as well as it can be. Obviously, with COVID, it's a different type of public engagement than we've ever had in the past. But I think we're doing the best we can with considering the circumstances to get the most input that we can and the most feedback that we can. And that's a good thing. There are definitely more focus groups coming in the very near future. There'll be I think a list published shortly of the different types of focus groups, anywhere from hard to reach populations to homeless populations. There'll be a law enforcement focus group, which law enforcement personnel and the collective bargaining. I'm sorry, not collective bargaining, but the union presidents or union memberships will be a participant on. Persons with disabilities. There's a whole list of different types of focus groups that's going to be published soon to get participants to participate, and they'll be facilitated by trained facilitators to get feedback to help provide information and data about thoughts, perspectives, and approaches with reimagining public safety. So I believe that list will be published shortly, and those conversations will take place between now and the beginning of January. So there'll be a lot of, I think they've already started actually. There'll be a lot of public engagement over the course of the next 6 to 8 weeks. I believe we have another Community Voices Forum this Friday. Is that correct, Deanna? And I think we have 1 or 2 more scheduled after that. Again, I've sat in on them, sat through most of it, on all of them, and a lot of good feedback, a lot of engagement, and understandably, and I acknowledge some frustration with the public just in the process. It's a slow-moving train. It's also a different process because we're not having in-person conversations, and I think people are getting frustrated, understandably, about that. And we're trying to, accommodate that and react to that as we can to make sure that people's voices are heard and that perspectives are taken in. So, we meet every 2 weeks as kind of a leadership group. Rich, I believe you're in on those conversations. And that's kind of a download of where everything is, how the different groups are progressing forward. And I have not sat in on all the working groups discussion. These are folks that have expertise in the area or specific knowledge with those specific areas, but I know they're moving forward and progress is being made. The most recent discussion we had, which is a good committee to bring it up, is looking at the timeline for submitting a report to the state, which is, frankly, at least from my perspective and the county's perspective, is one achievement we have to make in this process, but is really just the beginning of what I call, the first step to a longer stairwell of approach and progress. But I'm probably going to request in the beginning of the year that a special meeting of the legislature be held the last week of March, so that the plan can be adopted that last week of March, allowing for the most time for review and comment prior to that date, so that we're not stuck with the second meeting in March as the time that the legislature has to take action. So I think once we cross the new year, we'll probably come through this committee and recommend that a special meeting be set towards the end of March, and the city is looking to do the same thing. One discussion that recently came up is submitting a report. Is it a joint report? Both the city and county create a report together and submit it together. well, so we have to submit it separately, but it's a joint plan. So I think we're still talking through that to see if that's the best approach. But those are some recent discussions we're having about the plan and what we would be submitting to the state. So that's kind of a very, very broad overview. I think we put out, the website is up and running. Dom's done a good job in keeping the information updated on the website. We put out a one-pager that kind of went through the timeline of things and where I think we're looking for a draft findings and recommendations probably by the end of January, which would be up for public review and discussion, and then seeking public comment probably with a more formal plan coming shortly after that for consideration by the legislative bodies. So it's, there's a lot of moving parts, but I think we're starting to move in the right direction. We're starting to see progress. It was understandably a little bit slow on the uptake, getting a lot of people brought into the process and a collaborative effort, but I think we're starting to move in a much quicker direction. Deanna, I don't know if you have anything to add. You've been in it really since you've arrived at the beginning of the month.
Sure. No, I think you provided a great overview. Just I guess further reiterate that with the pandemic, public safety, both in terms of law enforcement, but also in terms of the community, and having those considerations have been at the forefront of how we've engaged the community. Specifically, in addition to the website, there are one-page forms. There are paper forms you can drop off at the library. There are forms that you complete online. In addition to the focus groups, we're also recognizing that folks may not want to come to Community Voices. They may not want to be in a focus group, but they also may need because they are a specific target audience or population. We're also doing individual interviews with folks who are the hardest of the most difficult population to reach. And so we are working with folks who work with various populations throughout the community to reach those folks, in addition to the focus groups. We've also engaged folks from the research committee, research group in terms of Ithaca College as well. So we have an academic component, which is important in terms of hearing those voices, so that we can ensure that the data is collected with integrity and a level of confidentiality in the process. So I think you've done a great job, but I said this to the leadership team the other day, but I also want to say it to you, is we all have a role to play in this. And if you have folks that you are speaking with or communicating with on a regular basis, please give them the one-page sheet. Please send them to the Community Voices. Please have them go on the website. Their voices are to be heard. Another item we've also engaged in, we also recognize that in Community Voices, we can't capture all of this. And so this week I've had multiple appointments with the residents of our community to just hear their voices individually. So I've had at least 5 to 7 hours worth of meetings just this week alone, just scheduling folks who've had a comment that they listed in the chat. So we needed more information to those who may have felt marginalized or left out of the process, to re-engage those folks. And so I spent a lot of time doing that as well. So it's not just those things. We're also doing essentially almost one-on-one follow-up after we have these different sessions. So there's a lot of good work to be done, lots of hard work to be done, but then also making sure that we have a comprehensive conversation as a part of the process.
Thank you, Deanna. I would also add, I know the sheriff's been involved, Jen's been involved, Matt's been involved, Dan, Lance, I don't know if you have anything to add. Henry, Rich?
Yeah. One thing I'd say, Jason, is nice product placement for gummy bears. I hope you're getting a royalty.
Yeah, someone sent this to me, I think, after the town hall a few weeks ago. I don't know who it was, but.
Certainly for the committee, one thing that I think we should be thinking about is that we're going to receive some real significant recommendations, I think, and those will almost certainly involve emergency response, because of a lot of discussion about how calls are routed and where they're routed, and some perhaps more nuanced assignments of calls to non-police officers for certain kinds of responses. And then also perhaps some difference in structure of having more people that can respond to different types of calls. So we're going to have a more nuanced force of people responding. And Sheriff and Jen, I'd love to hear you guys comment on this, but from a budgetary standpoint, we're probably going to be called upon to endorse some recommendations that will have significant budget implications in the coming year. So I just wanted to give you all a heads up, but I'll stop talking. Brian, Jen, Derek, do you have any thoughts on that?
Thanks, Rich. I can say I think we're extremely blessed to have CPE helping us with this. I'm not sure where we would be without them, but as far as what's coming down the road, it's kind of hard for me to anticipate at this point. I think we're still kind of early on in the process, and I'm not sure what's going to come out of it, but I think we should keep plugging away and see what happens.
Yeah, certainly we don't know yet, but my sense is that there will be recommendations with some really concrete changes, substantive changes.
Rich, I would add to that it may not come out of the immediate process, but it will definitely tee things up, I think, for an engaging conversation that will carry much more beyond April 1. And that's where I think you may see where you end up going at the end of the day. I've said from day one, there was no way that you were going to reimagine law enforcement or public safety in 9 months that the governor's timeline put out. But I think it lays the foundation, and definitely will probably have some immediate things that can be done. But your longer, more complex initiatives that maybe your larger monetary ones, I think are going to require another good engagement over the course of the next, I don't know how many, what's the next steps after April 1, where I think that's where you're talking about is going to come into play. Nonetheless, I think it's a good forewarning to understand that we want to take this seriously, and we want to understand where the right investments are. And that's why I've said I think this April 1 is one deadline, but it is the first stairwell and first step in a long stairwell as we go through this process.
Yeah, Martha.
Thanks, Rich, for taking me. And this is a great discussion. My question is about the Ann Milgram presentation, the district attorney general from New Jersey, and the Camden example. Can you tell me if there's any particular takeaways from that? Because I did some reading afterwards about that whole case, and I was unclear of kind of what the main takeaway ought to be from our point of view. I wondered whether among your group you had any particular lessons learned from that.
I could say I don't know that I've had much conversation with the group beyond that initial presentation. I'm familiar with the situation. I was familiar with it a little bit before this. And there's probably a few takeaways to take from it, but I don't know that we've engaged in at least I haven't. I don't know if you have, Derek, in the Public Safety Committee to talk more about it or not.
No, we haven't had really any conversation about that topic, and I thought it was an interesting choice of speakers to bring in. I'm not sure who invited her, if it was CPE or somebody else, but I know it's resulted in a lot of rumors, to say lightly. I think it's struck a chord with a lot of IPD members that are fearful of what's going to happen with their agency if people are looking to disband them. So, but that's all I'm hearing. There has been no real conversation about that presentation that I've been a part of.
Matt? You're on mute. Yep.
Yeah, thanks, Rich. I've kind of felt the same, I think, as Martha after seeing the presentation of Ann Milgram. I was intrigued, but I was also kind of at a point where I thought it was so general and non-specific that I didn't really know what to take away from it. So I did a little research as well. And Dan Cornell and I have communicated a little bit about that in the aftermath of her presentation. I think she's on a board of an organization that pitches an assessment tool that she kept talking about being data-driven, but she didn't really give any specifics about what that meant or what data she's talking about. But the assessment tool is how she says that Camden decided for pretrial release and where to send police, based on the assessment of prospective future criminal behavior. And I don't know much more about that tool. I know it's something I think she has said in a TED Talk that was going to be in every municipality in the country at some point, but I haven't seen that happen, and that's been a few years. I don't know if Dan has any thoughts.
Sorry, I just had to unmute. Thanks, Matt. Yeah, Matt had brought this to my attention, and I did a little research. It is widely used in the state of Kentucky, but we could not find for judicial decision-making from the bench as far as whether or not to release folks at arraignment. It's, to the best of my knowledge, there's only one certified instrument, the approved instrument in New York State for that purpose, and we've talked about that previously. It's out of New York City. A copy of that, I believe, was disseminated amongst this group 6 or 8 months ago. So I haven't spoken with anyone in Kentucky to see, what they feel about it, but it is widely used there. I could talk to some probation folks down there and get a better sense of it, possibly get a copy of the instrument if that would interest people.
Certainly, it's interesting to see what was done in Camden. But, trying to translate that to Tompkins County, I think you have to be pretty careful because Camden's a much larger municipality. It had remarkably extreme criminal justice issues and, nowhere near the same economic activity that we have here. I think we're really going to need to tailor our own response. I guess it's good to prod thinking. I don't know whether it's how applicable.
I think, Rich, if I may, there was also a major financial consideration, which was dire in that community, and that was, that wasn't pandemic induced or anything. It was just the circumstances. If I were to take anything away from it, it is a process and an approach another community took with a certain outcome, and I think you keep it in the toolbox, and if there's something to pull away from it, you can go back to it. I don't know who invited the Attorney General to the discussion, but that's the way I view it as, all right, it's knowledge that we're now aware of and how another community approached things for a variety of different reasons and variables. And if there's a time where we need to pull something out of it that may be helpful, great, we can do that. There's also a lot of heavy state involvement that allowed that to happen, which would be unprecedented in New York, let's just say, if that were to happen here. So, I think it's just another example, a case study, a tool that we can keep in our toolbox. And should the time come up, we can pull it out and look at it and see what elements may work for us and may not. That's my takeaway from it.
Yeah.
Just to couple with what Jason said, and I actually agree with you, Rich, you were thinking exactly what I was in terms of this is a very independent and autonomous place. And so I'm in my short time here, I can see that you very clearly, we make our own rules here, which I think is awesome. But as a part of that, I think that speaks to what you're seeing. When we started the process with Center for Policing Equity, we said we didn't want to engage in any best practices that we didn't feel like would adhere or build upon what we currently have. And so with that in mind, I think it was the reason why Ann Milgram was asked to come as one is to give an example about a particular process. But then also one of the things we've heard from Center for Policing Equity multiple times is how many cities and counties are grappling with this, but some are choosing not to take it on because it's so difficult. And so in an attempt to encourage our process or encourage our citizens and our residents here, she was asked to come to provide an example to actually commend the work that's actually happening here. So it is a framework, but it's not necessarily the framework we're going to use here. But again, it was just used again as it's something to potentially create a comparison or a contrast, but at the same time saying that there's lots of good and hard work that's occurring here at Tompkins County in collaboration with the City of Ithaca, and we should take it as such. And then knowing that back to the larger picture that you asked about, there are going to be administrative and budgetary considerations that will go into this that will ultimately, hopefully, guide our decision making in addition to the integrity while maintaining integrity within the process.
Okay.
Thanks very much. I really appreciate that feedback because I was really puzzled. She actually left the AG's office before most of that stuff actually happened, as far as I could tell from media reports. And actually, Madam, kind of interested in the idea that she might be part of an organization selling a particular piece of software. Is that, I don't, you know, so plus, as I remember, Camden is something like 80,000 people, and they started out with 250 sworn officers. So, like, really kind of a different universe from us.
Yeah.
But I appreciate, you know, always, I was interested. I'd heard a lot of news stories about Camden over the summer. So I was very happy to hear a bit more about it. So thanks very much.
Great. Yeah. Henry.
Yeah, also, I mean, I assume she was brought because in the defund the police movement, they often pointed to Camden as a spot, but they didn't know. But again, the governor's budget had a lot to do with it being defunded. Also, she did talk about how the dispatch calls went incredibly decreased based on the data. And I think that's one of the takeaways that we should look at, is to see, you know, whether, again, you can shift off dispatch calls to another section.
Yeah. Okay. Anybody else on this topic of police reform? All right. Okay.
Yeah, I just wanted to say I found out today that you guys are using the CEI students to do interviewing for the people, for the participants of the police reform. So I think it's great that you guys are using, you know, the graduates of the CIU program in connection with that.
So just to add to that, we're doing that in collaboration with the faculty who are trained and to provide a professional development opportunity. So it's a monitored process, but yes, we've also had them engaged in some of the work groups as well. Students have been gung-ho, and we really appreciate their energy and enthusiasm. And actually, they've provided a lot of really strong ideas as well.
Yeah.
Okay. Anything else? All right, let's keep moving. Sheriff's Office. Welcome, Sheriff.
Thanks, Rich. I just got a couple things in addition to our written report. Currently, our head count as of today is 39. However, we do have 6 that are state ready. They're going to be headed out. They're scheduled to leave tomorrow. So that should bring us down to about 33 again. We just had a COVID inspection done of our jail yesterday by the state commission. They were very happy with what they saw. We did have a couple scares with COVID in our agency overall. We had a small effect on our road patrol and civil office, but luckily we were able to catch that very quickly and didn't have any spread. So nobody is currently out due to COVID, and we yet to have a CO or an inmate infected. I just wanted to touch on the last couple of meetings. The idea of a staffing analysis with the state was brought up, and I think maybe now is the time to consider that and request one. It seems like we got a pretty good length of time with much lower head counts, and right now in this particular time, we're really suffering from our disability time usage by employees. We have 8 currently out altogether, which is a lot of people for such a small division. I think our building design will obviously be a little inhibitive of what they're going to tell us, but I'm to the point now, I don't think what they say would be any worse, would put us in a worse position, and I'm hoping maybe it'll help us lower our staff count need a little bit. So I'm hoping to do that next week, unless there's any strong opposition to that. I would certainly like input before I do it.
I think we'd be happy to criticize later if it doesn't go well.
Right, yeah, exactly. I'll anticipate that, but I know we've fought back with them in the past when we didn't like what they had to say, so I'm prepared to do that as well. I'd be hard pressed to think they would have any a leg to stand on to say we need more people than we got. I'm not sure how that could possibly happen. So I think right now it's probably a good avenue for us to take.
Derek, Derek, are you aware of, isn't there some, I thought there was some legislation that was being requested, or maybe it's not, maybe, you know what it is, maybe it's NISAC has recommended to the governor's office, and this probably hasn't come yet, but this may be part of the budget. You may have heard this with the Sheriff's Association, that they're recommending language to allow sheriffs and chief executive officers to determine their own staffing levels. Have you heard that?
No, I don't think it's that, unless I could be wrong, but I think what NISAC was pushing was to let the legislature request a staffing analysis, whereas now only the sheriff can ask for it. I think that's what I heard at least, but I could.
I think it's a little bit more locally driven. Because it came up on my county administrator's discussion, because most of us are the CEOs, we would be working with you, the sheriff, to set our staffing levels locally versus a requirement by the state. I can dig into a little bit more and figure out what it was.
Yeah, that would be helpful, and maybe we can base on that before I actually send the letter off.
Let me follow up with NISAC.
Okay.
I do believe you're right, Jason.
Yeah, but let me follow up with Ryan Gregory over at NISAC, Derek, and I'll get back to him what he says.
Okay, all right.
Either way, I don't disagree with you. Obviously, the only risk we take when we ask the state corrections to come in and give us a staffing analysis is if they tell us we need more, then we have an uphill battle to argue it.
Right. Yeah, we've been, Jen and myself have been working with Lisa in HR and Jim Romer's firm to try to enact some more light duty work options to try to encourage people to come back full duty. So we'll be working on that in the coming weeks as well. This has been an ongoing problem. We're a little different than most counties where we offer that 900 plus hours of disability time each and every year. And we've been unable over several years to negotiate that out of our contracts. And it really hurts us all the time. So we're going to try to come up with some ways to get around that a little bit.
Okay.
Yeah, I think that's all I got.
Well, I see there's a resolution. It shows up in emergency response, but it's replacement pay for the sheriff.
Yes.
So before we get there, Henry, you had something further?
Yeah, I was just wondering the list of the protest detail. I assume that's for the day where they had to do the combination protest.
Yeah, that's the day we went down and helped the city out. That was the big one where we had the two different movements converging on the commons.
Did you go down for any other times to help the city out?
We were called down maybe 2 to 3 times, just shift cars, not on overtime, for protests they had in front of the Ithaca Police Department, but nothing that cost us any money.
Okay, thank you.
Hey, Martha.
Thanks a lot. This might be a Jason question. Have we had any 730 expenses? That's the program where we pay mental health.
Yeah, I don't know. Let me check with, it's erratic in terms of its billing. Matt's not his head up and down. So I could check with Jeremy Porter and Matt and Frank and see what we are budget wise. But it's usually a sporadic billing, but let me find out and I'll get back to the group.
Okay, thank you.
Yep.
Okay. All right. We have resolution 9639, appropriation from contingent fund replacement pay reimbursement sheriff's office. Could I get somebody to put that on the floor? Anna moves, Glenn seconds. Questions or comments? As Sheriff, as you said, this has been a continuing issue. Yeah. Okay. Anything further on this? We ready to vote? Glenn?
Yes.
Anna?
Yes.
Henry?
Yes.
Mike?
Yes.
And the chair votes yes. So thank you. Okay, anything further for our sheriff? All right, let's move on to Department of Emergency Response. And where's Brian on the boxes? There he is up in the upper corner. Welcome.
Didn't recognize me, did you?
Yeah, I didn't. I had no idea.
I'll entertain any questions that you may have with regards to the monthly Tomstat report. I know one that's been coming up, and a lot of these are since the age of COVID. Domestic disturbance is up, but if you look right above it, dispute is down almost a consummate amount. So a lot of times it's not quite clear from the caller which it is. So that may be a wash. I don't know. But that's an observation I had from the stats. Overdoses are down from the 5-year average for October, roughly 50% from the previous 5 years. Property checks are still up. Psychiatric calls, again, we touched on this earlier, seem to be down from averages. And those are the notes I had on it, but I'll entertain any. And again, these are just numbers, you know, we don't have any control over them. We can try to interpret them, but
Sure.
Simply the numbers that we have.
Okay, Henry.
Yes, Brian, what's information?
It's a general call. They're looking for information. Those have been up actually since COVID. And a lot of it might be, you know, with reference to, you know, testing sites and things of that nature. You know, 911, that's an easy one to remember. So when something pops into somebody's head, it's like, oh, geez, I'll call 911. They'll know.
As opposed to 211.
Yeah.
And also, I mean, property checks, I mean, wouldn't you expect those to go down as we got more, you know, out of COVID?
Probably a better question for Derek, but I would say no. Go ahead.
Yeah, our property checks have increased because of COVID. I mentioned in the past that our overnight shift has spent extra time performing property checks on businesses that are closed or perhaps not fully operational to provide better safeguard against burglaries and things of that nature. So they're going to remain high probably through COVID.
Okay. Thanks.
Other than that, we're continuing to work on ways. See, we're a critical agency, so most of our employees are here, have been here. Obviously, the dispatch staff has to be here with minimum complements every day, and how do you do that safely? In the age of COVID. Our department too has been hit by COVID, not badly, but it has. And, you know, we're not naive enough to think that it's not going to. It likely probably will. And how do you react to that and still get that, you know, the staffing levels that you need to have. So it may be working on the frequency that they're here versus the total amount of time, which means increased hours and more time away, less appearances, if you will. And, you know, we're also looking at, for the other side of the house, our side of the house here, you know, work from home, which is difficult, but we certainly have to look into it. And last but not least, we also still have and will continue to have for probably some time now, the EOC staff is also here. It's okay, we all get along great, but you know, it's more people in the building. You know, we've been asked by administration to look at that. We are looking at that, kicking ideas around, as is everyone else in the county. But it's a you know, it's an issue that we have to try to tackle. So In the meantime, we do continue with our projects. Obviously, our biggest one being the planning for a backup center, dispatch center. That seems to be going well. We know what our mandate is in terms of being ready to present a shovel-ready project to you all. And I guess that's about it. And
What kind of timeline on that? When do you think you might be coming to the committee on the backup?
well, chances are we'll be updating you as we go. Right now, we know what we need, but we're still trying to nail down where at Cornell this will be. And once we get that location, things will more come into focus for us. And they're working on that. They're working on one of the big things is going to be MOUs that are that need to be in place. Yeah, there's a lot to it, and we'll certainly keep you apprised as to progress on it. Not the least of which is going to be the price tag.
All that, yeah.
I'm sure you'll be anxious to hear that. But
right.
But that too will come. We have regular meetings and sidebar meetings quite often. So it's full steam ahead with that.
Okay. Henry.
Yeah, I just have a question actually for Jason. Because Brian talked about COVID infecting his place. Are you keeping records of all the county employees who test positive for COVID in the departments?
We have that record, those records, yes.
Okay.
All right.
Might want to share them with the legislature?
No, I'm not. It's personal medical information. You're not entitled to it.
Oh, well, not names.
Sorry. I mean, we have obviously, there are records of individuals that test positive. We're not always entitled to that information, though. So it's very possible you could have an employee that's working remotely that could test positive and not share it with their employer, and we would never know. And they could be an out-of-county resident, and we would never know that. You have to keep in mind, your right to know doesn't trump their privacy if your health is not at risk. It's no different than a disability.
Yeah,
I
but
think
you
this
did
is a
in fact
discussion
tell us.
for.
Okay, another time.
Let me ask you this: what were you trying to get at, Henry? What were your reasoning for knowing?
Well, my reason was that you talked about DSS having a positive person, but I didn't hear about DOR having a positive person, and so I'm just wondering whether or not you're keeping information about each agency and whether they have any positive tests. Because I mean, this is also going with Martha's idea of having more people work remotely. And
Right.
So I just wanted to see whether.
Yeah. So just because there was a positive case in one department and there was an announcement to staff, doesn't mean that would be treated the same for another department. And those are all circumstantial based on the instances, based on the potential close contacts, based on the individual's request. So, while one department may have had a positive case, the individual's never announced and the circumstances about the specifics aren't, but a lot of times because there might have been close contacts and there might be other people quarantined, it's appropriate to advise that unit as to what's going on and to why. Where in other instances, for example, the example I just gave you, where there might be a remote employee that's working from home that lives in another county, which there is no exposure at work, the only person that would know would be maybe the department head and maybe the HR commissioner. Those are very different circumstances, and they don't necessarily require the same level of communication throughout the organization.
Okay.
All right.
I mean, what we are going through is a density reduction and a density planning process. Brian's been part of that. Jess has, Derek has, Jen has, Dan has, Matt. Every department has been part of it. We just had a conversation. What's today? Thursday. Yesterday about it. So all departments are going through a planning process to put forward some density reduction plans for 2021. We're well aware of it, and a lot of departments have already and continue to be reducing density. Some have challenges for a variety of reasons, and we're going to work through each of those departments to try to put together a plan that'll work. Yeah.
If I could interrupt you, this really seems like a discussion for another committee.
Yes.
I'm not sure this is public safety, but
okay.
An important point, but just, I think it's somebody else's issue to think about. Martha.
Well, if it's budget, capital, and personnel, I would really like this to be followed up on. And, you know, if it has to be an executive session for the legislature, it affects expenditures, policy, you know, a lot of things that we are responsible for, you know, space operations, et cetera.
What exactly are you asking for?
Well, I think this is another committee. This is not. We have enough to worry about, I would say, if we could move on. And I'd like to get the resolution on the floor. Resolution 9718, appropriation from contingent fund, replacement pay, Department of Emergency Response. Can I get a, Glenn moves? Do I have a second? Henry, thank you. Okay, Henry seconds. Questions, comments, discussion? We're ready to vote. Glenn?
Yes.
Anna?
Yes.
Henry?
Yeah.
Mike?
Yes.
Okay, and the chair votes yes. I think that's unanimous. And then we have resolution 9719, authorization to accept grant, Department of Emergency Response. Could we get that on the floor?
I'll move it.
Thank you, Anna. Glenn seconds. Okay, anything you want to tell us about this one, Brian?
No, just that it's part of a larger annual grant that we get. This is one part. So you have to expend the money and then bill it and get the reimbursement for it. So this is one of several things that add up to the $86,225 up above that you folks have already accepted. It's just an expenditure from that grant that we've already accepted.
Okay, so we want the money, it sounds like.
Yes.
Okay.
We always want money.
Ready to vote. Glenn?
Yes.
Anna?
Yes.
Henry?
Yes.
Mike?
Yes.
And the chair votes yes. So thank you. Anything further from emergency response? Ryan, Jessica? Okay, thanks for coming in. We have Department of Probation and Community Justice. Oh,
Rich, you forgot Matt.
I did. I'm looking at it now. Yeah, I jumped over Matt, and I'd like to make sure we hear from Lance as well. Let's go to the district attorney.
Thanks, Rich. I was actually just emailing and forwarding an email from the Office of Court Administration because we are looking at and have been getting kind of bits and pieces of information about how the courts are going to scale back operations. And it's somewhat frustrating because this is coming from a state entity and they pass this information out to everybody but the county entities like the DA's office, which is probably one of the biggest stakeholders in the court system. So I was pestering one of the chief administrative attorneys and literally just got a copy of some of the protocols that were updated and sent out to the town and village courts in the last day. So I was passing that on to my staff. It's reflective of some of the increased cases that the courts are trying to scale back the number of people in courtrooms, physically in courtrooms, mandating dealing with traffic tickets virtually as opposed to in person. The biggest effect that the scale backs have on us locally is that we have a grand jury now. There are 3 more sessions of that grand jury, and once that grand jury is done, we are currently not allowed to impanel a new grand jury. So any serious felony cases that happen after December 17th will be in a limbo that is similar to what we had in earlier 2020 when the courts were shut down as well. We have had grand jury for the last few months and have been using grand jury to move cases along. But this is a step backwards, and I don't know when that's going to reverse course again, but that's something that we're paying close attention to in my office. And you know, if there are serious cases that are unresolved, in other words, if someone is in jail facing a serious violent felony, we're not going to be able to give them a jury trial anytime soon.
Mm.
So, I mean, and the courts have told some of the speedy trial requirements that we often, you know, are faced with in recognition of that. But it's a matter of fairness and a matter of, you know, what do we do to minimize the risk to people who are incarcerated. So far, there haven't been any COVID cases, thankfully, at the jail. But you know, should they have to wait longer than they normally would for a trial, there's a lot of different layers to that thought process. They have been waiting shorter time periods because of the 3rd county court judge, but now nobody is allowed to have any trials. So there's conceivably a couple of individuals who are charged with very high-level violent felonies who will have to wait a little longer for a jury trial than they would have before this rollback happened.
Okay.
And that's the biggest. Martha, I think, asked about 730. There's at least one person who committed a very high-level violent felony and is in Rochester Psych Center now based on the 730 order, which an evaluation found him to not understand the court process or be able to assist in his defense, which is the legal standard for that. And the consequence of that is that he is sent treatment in a psych facility until he is competent to stand trial, at which point he is sent back here. But the bill is pretty significant in the meantime. I think it's like $1,000 a day that the county is stuck with for those cases. So I think aside from that and being happy to be part of the police reform conversation now, that's the update I have.
Okay. Yeah, I was going to ask you about the 3rd county court judge. I've been meaning to bring that up at one of our meetings. But it sounds like with the pandemic, they really haven't been that active.
Yeah, that's true. I mean, the timing was terrible in order to be able to recognize the benefits of having that 3rd judge. By the time I actually had a trial with the 3rd judge, Judge Miller, that started in February and ended in March, just before the shutdown. So one case went to trial more quickly than it might have otherwise. But then since then, we really haven't been able to reap the benefits of that additional judge.
Yeah. Okay. Henry.
Yes. Matt, except for the lack of the grand jury, is there anything else? I mean, are you guys going down to 50% or anything else in that email or from the state?
Well, the state is only talking about the court operations, so they can't tell us what to do with our office. That being said, we're trying to be very careful, and as all the county departments are, when people can work at home, they do. We try to shuffle the schedule to minimize the density of individuals in our office. And, we continue to look at that very carefully to be as safe as possible.
Anything further for the district attorney? Great. Lance, I see you're here with us.
Can you hear me now?
Yes.
I don't have a lot to add. Just one little follow-up. Well, I have two things on that. Matt's correct. I think the criminal caseload for that third county judge has been down. They've been much more active with family court. We see family court that Matt doesn't have to, fortunately, deal with. I'd be happy to trade with him. But the courts have been much more active with family court than the criminal cases. For a variety of reasons, but on that, the only other thing from us is just an update, so you're aware of, because you'll see this coming down the road. We've finalized the
You've gone off mic.
I hit it by mistake. I'm sorry. I put my hand on it when I was trying to mumble and cover up what I was saying.
Yeah, I think you were saying something important.
Yeah, that's why I was covering it up. There's nothing to see here. No, we've just so you're aware, because that'll be coming down the pike. You'll see that's in its final processes. So I think next month, hopefully, we'll have signatures and everything on it to move forward. If someone can efficiently finalize the writing on it.
Okay. Any questions for assigned counsel?
Rich?
Jason?
I just have one thing to add. Lance and I have been in contact with Schuyler County about renewing the contract with Schuyler County for 5 years for supervising their assigned counsel program. So I talked with Tim O'Hearn, the administrator, and we'll be working up a draft contract for 5 years moving forward for the legislature to consider in another, say, month or two, Lance?
Yeah, no, I hope, I was making fun because I'm the person who has to draft it. So so that's why I was saying if the person who drafts it can get it done.
That'd be great.
I would be hoping that next month we have signatures on it and it's done.
Great.
So
great. Also, I think the camera Matt got you is wonderful, Lance.
It is. I'm sending him the bill. He better start selling stuff in his office so he can afford to pay for it.
Okay. All right. Keep moving. We have Department of Probation. Dan Cornell, welcome.
Thank you. Good afternoon, everyone. Starting to see our numbers for criminal court supervisions trend back upwards the last couple of months. Not sure how that will be impacted by the news that Matt just gave us, but it may slow things down again a little bit. We're still hovering below 500 for criminal court supervisions. Our work with PINS cases, which we tend to start getting a lot of kids with truancy issues this time of year. They've demonstrated, a certain number of absences, and the schools start making referrals. That's not been the case this year, partially due to kids not missing schools due to the remote nature of school right now. Most kids are attending 2 days a week, and then there's 3 days remote in most of the districts in the county. So we're not seeing the truancy complaints. Anything that we do get for kids not logging on to the calls we get for kids not logging on and doing their work at home, we're trying to steer away from PINS with our SOS program. So we're keeping them out of the court process entirely. That's been pretty effective. And so investigations, again, we're starting to go up, and typically at the end of the year, November, December, it's like the courts are doing their clearing of cases, trying to get rid of everything from the calendar year. I doubt that we'll see that this year, especially given the changes from the 6th Judicial District. So we're maintaining, we're quite busy. We're looking forward to the end of this month and next month being involved with the Cops, Kids, and Toys program pretty heavily this year. On the 18th, we'll be going around collecting 50 donation boxes, bringing them to the center so that the toys can be sorted and packed for the kids. And then on the 15th of December, Probation will be staffing 3 of the delivery locations, the pickup locations. We're not doing deliveries this year. So we're excited about being part of that. Carla and I have been meeting one at a time with our treatment providers in the community. We met with Erica Catraccia beginning of the month to talk about our interactions with CARS and how treatment's going, and had conversations with Susan Spicer at Mental Health in regards to the same thing. Just trying to keep the lines of communication open and expressing what our needs are, and for them to express what they're needing from us with the varying situations of people working in the offices or working from home. I'll aim to have a similar conversation with either Angela or Helen from Alcohol and Drug Counsel. Just to facilitate good treatment outcomes for our folks, because I think I've mentioned before, we're starting to see some weariness with the telemedicine, but with the COVID numbers, we're respecting what other agencies need to do for their own safety and their staff. And as Jason mentioned, we're working on our density reduction plan. It will most likely look a lot like it did when we were, when the governor's executive order came through looking for a 50% reduction in staffing on any given day. We're going to create 2 cohorts and work through that. In order for people to be productive at home, we've gone through our budget lines and we're going to procure 22 laptop computers. So that you may see some money being moved around so that we can do that. I think that's imperative for us to be able to be productive at home. If we have VPN equipped laptops and can use a soft phone attached to the laptops, our people will be able to make calls and access all the data and programs that they need to do to be just as effective and busy at home as they could be here in the office. In addition to that, officers will pair up and continue to do field contacts on days when they'll meet up, they'll go out and do field contacts and just not come to the office that day. We'll develop a check-in process so that they can call in and call out to their supervisors by text message or telephone for safety's sake, just to make sure that they're still on track and haven't run into anything for safety's sake.
Okay.
Those things. Did have one other item. Oh, day reporting is still open. We're averaging between 1 and 3 people a day, which is low, but I still view it as a positive. We have our service providers here from BOCES as well as Kenneth from Cornell Cooperative Extension. So the programming is being delivered sometimes on a one-to-one basis. We may have one person working individually with the BOCES teacher and one working individually with Kenneth. So they're getting intensive levels of servicing, and in some of the cases that's been really good for them, for the clients to be able to work individually with the service providers. Our security officer, Rich Brewer, has really stepped up. He's been there a long time. He's been a big help as far as running the program. And I think we're in pretty good shape. We are down some staff due to planned medical procedures. We've got one out now. We'll have one going out in December. We'll have another one going out in January. So as one goes out and comes back, another one's going to leave. But we'll get through that. And all in all, we're doing pretty well.
Okay. Anna.
Yeah. Hey, Dan. I just one quick question. I was looking at the monthly snapshot, and we picked back up the swap in September and October. Reopened that program. I'm assuming that was part of our phasing back in.
Yes.
Now that case numbers have been increasing again in the community, and of course throughout the entire country, is the intention to keep that program open until like the state makes any decisions, or are you just tracking it? Has there been any change in how it's delivered?
Yes, the delivery, we changed. It used to be one of our community service work project supervisors would take 5 or 6 people out in a day. We've reduced that to the maximum number of people each officer can take out is 2. That way they can socially distance in the van when we transport them from here to the work locations. We did shut down for a couple of weeks because we're down 1 work project supervisor due to a retirement of the other. So we did shut down just to allow that person to have some time off, but we're back open, and we'll continue to do that as long as we can safely do it. There's a lot of protocols in place for cleaning the van after everyone gets in, or before everyone gets in, after they get out. So it seems manageable to do it in a safe way at this time.
Great, that's very helpful. Thank you, Dan.
You're welcome. Thank you.
I see the on your report that the parole violations continue sort of on the normal course, and they don't seem to have changed as a result of the pandemic very much. I was thinking it would be great if we could get the ear of somebody who's going to be involved in New York State government to really do something about this.
Yeah.
But hard to know who that might be.
I would not know.
Just looking at that, it seems like parole reform. We're just crying out for it. I don't know how you get it done, but good luck to you if you could push it.
Thank you, Rich. It doesn't, at the state level, I've discovered it matters less what committees you're on, because anyone could submit bills, but just so everyone here knows, I did put corrections as one of the top committees that I wanted to be on. So we'll find out sometime in the next month. I'll let people know.
Rich, just to update, there is, because I see stuff floating around, I don't know the status, but there has been a bill on addressing some of these technical reforms at parole, moving through the legislature, and they're focused on the governor now I think trying to get his buy-in. Just so you're aware of that. So there is there's something floating out there to address some of your issues.
Are you talking about the Less is More Act?
Yeah.
That would, that would be a nice attempt if they could go somewhere.
There's a nice article in the New York Post today that Cy Vance and Darcel Clark and Eric Gonzalez wrote about the Less is More legislation, and they reference 4 other DAs across the state who have endorsed it. They don't name us, but I'm one of the 4.
Thank you, Matt. Okay. Well, steady pressure. So anything else from probation? Any questions, comments? I wanted
to congratulate Anna on her election win. I haven't had an opportunity to do so yet. So congratulations, Anna.
Yes. Good.
Thank you, Dan. Thank you, everyone. This is the one committee I've been on the entire time I've been on the legislature, and it's been really important. And I have learned so much from all of you. I'm a better person for the experience that I've had. So thank you. And I will definitely take it with me to the state.
Okay, good. I did want to note that on the chat function, Deanna put in the website link for the Reimagining Public Safety. In case anybody doesn't have access to that, it's good pickup to go look at that stuff. And the public comment, I attended last week at 4:30 on Friday, and I think it's tomorrow at 4:30 as well. It's interesting to hear what people are coming in and saying. It seems to be, it's a little heavily weighted towards people who've been protesting, but that's okay. It's good to hear their voices, but you're getting a range of views. and it is doing its job of collecting public comment. And I think that brings us to the end of our agenda. But in the spirit of the times, I'd like to note Thanksgiving is next week. And from a public safety standpoint, I don't want to sound mawkish, if that's the word to use, but there's some things we really can be thankful for. Certainly from the public health standpoint, our community has done pretty well. And I would point out the role that our sheriff played with the schools opening and really stepping up. I think that made a great difference in our community. And then also a tip of the hat to our law enforcement for managing what really could have been some scary moments on the commons, I think, with the protests, and doing it in a really responsible way. And from a public health safety standpoint, what we heard on methadone, we've got really dedicated agencies in our community that have carried through this pandemic in ways that they never imagined I think they could. CARS is just one example of many, but you turn on the national news and it's really good to be here in upstate New York and Tompkins County right now. So much to be thankful for. And certainly if anybody has anything to add, I know it's a long list of things that are going okay here right now. So thanks, everybody. Anything else? Oh.
Thank you, Rich.
Okay. Well, we'll see everybody in a month, if not before. Take care.
Bye.